it's Kathy Turner and a little bit more about chronic pain and the pain scale. This is something that many find very, very difficult. And everybody labels their pain in a different way. If you've not ever had a lot of pain and you become a chronic pain patient, then you may tend to label your pain higher than someone who has been in pain for 20 years because they've gotten used to some of it. This does not discount your pain at all. So when you're filling out that sheet, 1 to 10, where are you on the pain scale? Most of us find that extremely frustrating, especially if that doctor hasn't given us what is 1 and what is 10. Your overall treatment is not based solely on your pain scale. It will be discussed with your doctor where you can talk more freely about your pain, and you can tell them, I don't know what to put on this pain scale. I put a 3 or I put a 10, but I really don't know. If any doctor or medical professional tells you, because this was kind of common in the older days, a 10 is like childbirth. Thankfully, that was rare. But if that ever comes up, there's 2 things. Number 1, to my recollection, a man has never had a baby, and they may think that 10 is so out of this world that they could never put down a 10. On the other hand, some women would consider a lot of things a 10 because they didn't have an easy childbirth. If you tell me to use childbirth as 10, then I had it easy. So you see where you have to be really careful on what level of the scale you're using when you're describing your pain. It gets confusing. It may say like the worst pain ever. Well, maybe you have been fortunate to have not had a bad pain incident, and this is your first time. How do you compare it? So there's so many factors that come into that. So I want to show you a couple of things that you could think about, but also remember, you can put beside the sheet, may we discuss this? I find that many are intimidated when they go to the doctor's office and they feel they can't say anything or whatever. It's okay, because if you don't understand something, your doctor wants to know. We have to be knowledgeable, but also on the other end, as a pain professional, be knowledgeable in knowing people really don't understand the pain scale. And I still struggle with it. 20 years and I still struggle with the pain scale. But different pain is hard to rate. And so it's good if there is some direction, and you can go on Google and find a million pain scales, but at least it helps you see how you can use the pain scale to your benefit. So let me show you a couple, and maybe it'll kind of clarify a little bit, because it is important to a certain degree. Okay, so here we have 1 pain scale. And I don't think you would be sitting in a pain specialist office if your pain was very mild, unless you were sent for another reason. If it's tolerable, maybe. If it becomes distressing, that's when you belong definitely in a pain specialist office. And you can talk to some of the pain specialists here, or you can ask some questions, and it may help us understand more of what they're looking for. One had my pain on, like a dress, then they may rate it at a different rate because they're feeling it differently. So that's why one reason I do not like comparing pain. And something that happens, and maybe it's happened to you invariably, you talk about your pain because someone asks you, and they come back with, oh, I've had a headache before. And that has nothing to do with chronic pain. That's acute pain. Hopefully the headache goes away. If it doesn't, then it does become chronic and they will see a pain specialist. But your emotions actually travel the same pathway as pain. So, and pain can be emotional. It's okay. You are not crazy. You're in pain. Pain is what makes us crazy. So, if it is excruciating, you need to say it's excruciating. In my view, this pain is excruciating. I have had pain, and I have had a team for 16 to 18 years, and that is the only way to go. And another video will get into that. But when I walk in and I say, I am not feeling well, they tell me they panic because they know that actually means real bad. So it's kind of, they get to know your personality, and they know when you're not telling the truth, which we really need doctors like that, because I have a tendency to lie, but I have a tendency to lie on the mild side. And I think a lot of pain patients do that because they're afraid of unbelief. So when I say I'm uncomfortable, what I really mean is there's a a huge nail going in my chest and out the other end. So the pain scale can be very helpful. Use it correctly and to your knowledge, not to the, you don't want someone sitting here, even if it's your significant other, saying, you know what, I don't think it's that bad. They can be helpful, but if you believe your pain is extremely bad, you need to say it. It needs to come from you. Now, on my part, my husband has to remind me, no, your pain is not very distressing. It is excruciating. And then I have to, I go back and go, oh yeah, you're right. We forget, because do you really want to remember? That's what one of my doctors said. I said, I can't remember. He says, well, do you really want to? So, just use your discretion on yourself, what others tell you, because it's really you that's in pain. Now let's look at another one. Actually, this is my favorite, and they took it away from me because I have a lot of other issues, including brain injury. And I can tell you better if it's drawn than if I have to explain. But you look at these and you can see these are used for a lot of children or in other settings. But you see how easy this is? A 0, you're happy. 1 to 3, you're happy, sort of, you start getting up there and your smile goes flat, and then you start frowning, and you're really frowning, and then you're red. So this is another tool that you can use. Here is my suggestion. If you have trouble with the pain scale, print your own and bring it so that you can say, I like this pain scale because I understand it better. Maybe you can help me kind of transfer it over to yours. It's okay, because they'll help you. You need to get that across to them, is that you don't know, or you don't understand the pain scale in front of you. Let's keep going. I will have to say that this is a lot of our favorites because it's a little humorous. I don't think doctors use these in their offices, but I like the wording at the bottom. There's no pain. It can be ignored. It interferes with task. It interferes with concentration. So that means it interferes with task and concentration. And it interferes with basic needs. So you are having a hard time taking a shower, you're having a hard time getting dressed, you don't eat, you don't want to do nothing. You just don't want to do. And then bed rest required. That's a 10. I would possibly say that probably starts a lot earlier. But I like this because, besides the faces, it tells you what it interferes with. And you can also write that down. Um, I can't I can't go to the mailbox. I can't walk to the mailbox, which is, I mean, if it's a mile away, that's a different story. But I can't clean my house. I can't do the dishes. I don't feel like eating. I I don't get out of bed. Tell them what you can't do because that helps a lot. And if you don't know where you're at on the pain scale, if you've got another pain scale you're looking at and you've put a 6, but you're telling them, I can't concentrate. I cannot do one thing but lay in bed, and I don't want to eat. Um, I can't do anything. So that tells them that it's really, that 6 is really higher. And they document that. So, these are really, if we could compile them all, it would be perfect. But the pain scale is something I think that a lot of pain patients struggle with. And I think a lot of these mixtures would be wonderful. I think it would help a lot. Now, let me just give you a couple of tips. One is you're not going to walk into the office and tell your doctor you are a 20. It's just stay within your realm. You sound credible, it's better. I will tell you that the last year I told my doctor I cannot rate my pain between 1 and 10 right now. So I'm telling you that I am going to rate it between 1 and 20 because the pain is so awful that I need that extra 10 so that we see more progress. And he understood because I wasn't walking in saying, I'm a 20, I'm a 20. I explained to him why we had to do 1 to 20. Do you know, not too long ago, I told him, we're scrapping that one and we're going back to 1 to 10. I am an 8. Now that is pretty high, yes, but we're back in the realms of what he's used to, and it's told him that there's been a lot of improvement, but I am still bad. At this very moment, what is my pain scale? If you'd like to comment, I'd love for you to guess, because we are the best actors. And that's what gets people is you're telling them you're really in pain, and then they come see you and you quickly try to wash your hair and do whatever, and you're smiling, so you're not in pain. We have learned the art of being in pain. And that fools people. And there's another video on that, and maybe it can be linked to this one. So, the pain scale may look difficult, it may look frustrating, but hopefully these little tips will help you. And discuss with your doctor how he views the pain scale too. But I would keep in mind what activities you're not able to do along with the activities you are able to do. And I think that will be helpful. Thank you for listening.